everything that you want to know about catheters. So the term urinary catheterization means passing a tube into the urethra, and that tube is going to allow the urine collecting in the bladder to drain out. The catheter itself is made of a long tube. It's made of either latex or non-latex if you're allergic. And at the end of this tube on the outside of the body are two ports. First port is hollow. That's where the urine's going to come out of. This is the port we would connect a urinary collection bag if your catheter is staying in. The other port is where we screw on a syringe. It's filled with about 10 mils of fluid, which inflates the bulb that is on the inside of your body. And that's the bulb that's going to keep this catheter in your bladder. Inside of the body, once that bulb's inflated, looks kind of like this. That means that catheter won't slip out of your bladder, and that means we have continuous bladder emptying. Urinary catheterization is a medical procedure, so it has risks. We all know by now every medical procedure comes with a set of risks. Main risk of a catheterization of your bladder is going to be a urinary tract infection. Even though it's a sterile procedure and we do our best to keep it that way, you're always running the risk of introducing bacteria into that urethra because we're putting something there that was not there before. Why do we make you get a catheter when you get an epidural? So epidural or no epidural, we would love mom's bladders to be kind of on the emptier side through the process, especially at delivery time. Now, why is that? Couple of reasons. First reason is a big bladder in the way of baby's head might actually slow them up from getting down into that birth canal. And it also can impede their ability of turning into the right position for delivery. Sometimes when we catheterize mums, a lot of pee comes out. This balloon has 500 mils of fluid in it, which isn't a common amount that comes out when I catheterize mums. 300, 400, 500 mils. This would definitely be in the way of a baby coming down into the birth canal. Now take a look at this. This one has 1,000 mils, 1 liter. And you're right, your bladder can actually hold a liter or more of fluid for one reason or another. My kidneys are overproducers, and this was me. And imagine this being in the way of baby's head. And one last reason why we love an empty bladder close to delivery, if this big bladder is in your abdominal cavity and you now have a uterus that has expelled a baby and a placenta, and it's doing its best to clamp down and control that bleeding postpartum, this big bladder is going to be in its way, and it now has less room to contract and to control your bleeding. There are 4 main ways you can empty your bladder during labor. First one we all know and love. It's the most efficient way to empty your bladder. You get up and you walk to the toilet. Now, if you're stuck in bed, there are 3 other ways you can empty your bladder. First one is a bedpan in bed. Second one is intermittent catheterization, which means a straight catheter, no bulb on the end, goes in, drains the bladder, comes back out. And the third one is continuous bladder catheterization, which means you put that catheter with the bulb in, inflate the bulb, connect it to a bag, and you're done. So no, a catheter is not needed in every single situation that an epidural is involved, and you need to know that. This is not a 911 situation. It's not like, I put an epidural in 20 minutes ago and you can't pee on the bedpan, so you get a catheter. At least it shouldn't be like that, because we know that bladders can hold a real large amount of fluid. So we have time to try some things out and to figure out the plan of bladder management that works best for you. Let's get this out of the way. As a patient, you have the right to refuse any medical intervention that we suggest to you or ask to do to you, period. However, if the mom is trying to use that bedpan and it's not going well, meaning she's not able to feel that urge to pee, she can't let go of the urine, or she's not putting out a lot of urine, and we know that more urine is being produced than is being put out, and we know that she has a long way to go before delivery is likely going to occur, we really need to be forward thinking about bladder control. Now, will you feel the catheter going in? Probably not. Let me be clear here, if the nurse comes in to do your catheter and you don't feel like you have adequate pain control since the epidural has gone in, you have every right to say to that nurse, I would like to delay my catheter being put in. Once you start pushing, that bulb that we inflated with that 10 mils of fluid, we're going to attach that same syringe and deflate that bulb. And most likely, as you start pushing, that catheter is going to be pushed out as well.